Let's talk about sedation at the dental office. What can you do to better prepare yourself before your appointment? Welcome to my channel, The Gum Dentist. I'm your periodontist, Dr. Alan Wadamina. Let's get started. If you're gonna have oral sedation, IV sedation, or general sedation, the requirements are pretty much all kind of the same, just kind of different variations. So I'm gonna go over the general requirements. Your dentist may have talked to you about more specific ones, but I'll talk about the most common ones here. For all these types of sedation options, you're going to want to have a ride take you to and from the dental office. Now, this needs to be someone you trust because there are things that can happen if you get a ride with a random person. You, Alan? Where are we? So please make sure you don't get into a car with a random stranger after sedation. We do want to make sure you get home safe. Wear comfortable clothing. You want to wear something with short sleeves because we do put different monitors on your arms. We might have to start an IV line. If you wear short sleeves, it'll be a lot easier to access. We have blankets if you're worried about being cold. And I'm sure your dentist already talked to you about not eating or drinking before the surgery, but I'm just going to reiterate it again. If you're having oral or IV sedation, typically you're not going to be able to eat or drink anything 6 to 8 hours prior to surgery. If you're having general anesthesia, sometimes doctors like to say anytime between 8 and 12 hours. So make sure you check your instructions and make sure that you don't eat or drink anything prior to your surgery. If you forget and you actually eat or drink anything, make sure you do let your dentist know that you did. It's really for your own safety that these requirements are there. If you have medications that you take in the morning, you are allowed to take it with tiny little sips of water. I'd say as little as possible. Make sure you don't down half a glass or anything like that. Some medications we use could have a rebound effect. What that means is that the initial dose we have will put you to sleep. Once you go home, you're gonna start feeling okay, you're gonna feel like you're waking up, and all of a sudden, a secondary rebound sedation effect could make you fall asleep again. So don't drive any vehicles, make any big legal decisions in the next 24 hours after surgery. And that's all I have for you today. Please comment down below about why you decided to do sedation surgery. I'd love to hear from you. If you haven't watched my last video about how to prepare for surgery, make sure you check it out right there. If you want to know more or are curious about what to expect after surgery, make sure you check out the video right there. Thanks so much for watching. Chocolate? Okay, sure.